Hi everyone, welcome to our presentation, and thanks for taking part of your lunch hour. We have lots of information, and we're trying something a bit new this time by breaking this series up into 5 separate sections. So it's a little bit small, digestible bites at a time. And what I'm hoping today is to leave about 10 minutes at the end as well for questions. So let's dive in. So as Allison said, I'm a speech language pathologist, as well as a board certified behavior analyst. And I have extra training in assistive devices program, so AAC, the picture exchange communication system, and pediatric feeding disorders. And I'd like to declare a couple conflicts of interest. I'm a salaried employee for Autism Ontario, and I'm also a clinical advisor for Lingo, which I mentioned in this webinar. So I want to declare that. So we are going to look at 4 big sections today about AAC. So first of all, get us all on the same page by talking about what is actually AAC, then who would benefit from AAC, and we're specifically talking today about individuals with autism. So this will be different than some of the other uses for AAC. What does the research say specifically for individuals with AAC, autistic individuals using AAC? And then how can you access AAC services, the supports, and the funding necessary? So let's dive in. What is augmentative and alternative communication? So augmentative and alternative communication, better known as AAC, is an area of research. It's also an area of clinical practice, and it specifically addresses the needs of individuals when speech alone cannot meet their communication needs. And it may or may not be the only way to communicate. So AAC may be your primary method of communication, or it may be a temporary method because you have speech issues, maybe laryngitis, or for clarification or specific uses. So maybe you're in a place where you're not allowed to talk, like a library. And so you may use an alternative or augmentative communication system such as texting or gestures or facial expression to communicate at that time. And those are all considered augmentative or alternative communication methods. So AAC is called augmentative when you use it to supplement, add, or clarify speech. So as the example I just showed or talked about was when you're using gestures, so like thumbs up, when you use textual prompts or signs or written language, those are all augmentative to speech. It is called an alternative when it's used in place of speech, so in place of spoken language. You can see some of the examples on the slide, so picture exchange communication system on the left, sign language on the bottom middle, and a number of speech generating devices and switches on the top right. I thought it was important to talk a little bit about the history of AAC because there's a lot of misinformation and wives' tales out there about AAC as it applies to autism. And so I'm not going to go through every single thing on this slide. It's pretty detailed, but I wanted the professionals and the providers that are attending today to have this information. So what we look at is AAC use began in 1920. So it's been around it's been around a century now, which is hard to believe. But that's 30 years before the first electronic device came into being in 1950. In 1950, the electronic device was a simple device that was developed, and there was no speech or sound generation at that time. So from 1950 until 1980, where that little star is in the middle, that shows the period of time where there was no real diagnosis of autism. So the diagnosis of autism was released in 1980. And at that time, there were only 3 to 4 out of 10,000 individuals diagnosed with autism. So the field of AAC was still relatively new, 60 years, but not really a lot going on about the types of technology that we have now. What happened in 2000, though, the year 2000, is the US released a law called the Use Assistive Technologies Law. And in 2000, it accelerated the research and development of technology to meet the needs of individuals requiring support. So in 2000, we have this law. Like AAC was pretty limited to people that weren't autistic up till then. And then suddenly we have this explosion now. And so we see that in 2010, so 20 years after the first sort of dynamic display, Apple launched its iPad products. So in 2010, although they've been around for centuries, decades at least, they've only been around for 12 years. So 2010 till now isn't a long time, but it's made a significant difference in the field of AAC. So what we're going to look at is, in the next decade, we're going to see exponential growth in technology. And we have actually since about 2010, when Apple launched its product. But if we look at what's out there, from 2021 to present, so the last 2 years, there's more than 150 apps for AAC purposes. But only 15 of those apps target language skills, and only 4 are for communication, which are backed by research. So there's been an explosion of technology. Parents can access a lot, professionals can access a lot, but the research for individuals with autism using technology has not kept up. And so let me, I really want to point that out, because that's going to be important for what you hear going forward, which may contradict some of the things you've heard from friends, colleagues, other families that have challenges with autism in their family. But I really want you to think about this. Technology hasn't been around for a long time. The field of AAC was almost 60 years without technology. So a lot of the things that you'll be hearing were during that time and don't apply to today. The other thing I wanted to let you know is that in 2022, this company Kamala released a new project. It's a research project, and the link is there, and people from Canada can elect to participate. And what they're looking at now is developing an app to assist people who are nonverbal or minimally verbal to communicate using their emotions and desires through vocalizations. So these are for individuals that don't have typical verbal content, and what they're looking at is artificial intelligence and machine learning to let the app learn about your child or the individual you're working with and make sense out of the vocalizations. And like I said, this is brand new stuff that's being developed. So this is where we're going in technology. So one of the things you'll hear me say over this series is don't fall in love with the technology. Don't make decisions based on a technology or an app, because these things are now at the rate of every 3 to 6 months. And we don't know in a year where we'll be from now. So we want to look at making good decisions. So let's get back to AAC and the types of AAC. AAC can be classified as unaided systems, where you don't require any tools or materials. So again, we talked about those gestures, vocalizations, body language, facial expressions, and the most common one we know is sign language. And there are various types of sign language depending on your language and where you live. There are also aided systems. So it's a system where there's some kind of physical object or device that you need. So you either need symbols or pictures or photographs. You might have a communication board, a PEX finder. And this category of aided systems is divided into 3 separate categories. The low or light technology category, so maybe printed materials, a communication board. Mid-tech, which may be a device, but it's not complex. So either a single switch, or maybe a device where the screen doesn't change. And then high-tech, which are those complex electronic devices, tablets with software, things that we're really all used to using. Think about your phone, your smartphone, your smart TV. Those are all those high-tech, complex electronic devices. When we look at those types of aided AAC systems, we also have to think about the cognitive load or the demand or the ease or most difficulty of use. And there's a ordering of what from simple, concrete to very difficult. And so you have to make decisions based on the user and the system as to where there is a fit. So when you look at this list, we're going from concrete, easy to understand at the top. So real objects, miniature objects, photos, colored pictures, black and white pictures, and we're getting more abstract and more difficult into those really abstract things like Braille, or more abstract symbols like bliss symbols or Makaton symbols, or even the symbols that you may see on a lamp system. Unless you're taught what they mean, you don't know. They're not, even for us, they're not apparent to us. So they're very difficult or more difficult. So I'm going to briefly just go through different types of systems that you may have seen or be familiar with, just to give you a rough idea about how much is out there. And remember, I said that there's only 4 communication speech generating devices right now that have any kind of research to back them. So not all of these have research, but they're out there and people are being prescribed them, or they're using them, or they're going to buy them. And so we're going to actually, through this series, learn how to make those decisions and how to match the system to your child. So there's things like the picture exchange communication system, Flip and Talk, which is a communication system that's pretty popular in Ontario and not so much other places. There's Voca Pen, where you use the pen and it talks. Go Talk 20, WeGo, there's NovaChat, iSpeak. There's a Big Mac communicator, so a single switch. So some of these early systems are for those who have physical or mobility issues as well, and not specifically for autism. Then there's more sophisticated systems that have hardware that goes along with the software or the app. So some of these are also the concrete hardware that you have to buy. So like the Dynavox or the Zygo. And then there's Cough Drop, which is a software. And then ones that people are a bit more familiar with now, or some newer ones, LAMP Words for Life, which is based on a theory of motor planning. There's Proloquo to Go, which is probably one of the most well-known and popular, and Lingo, which is a newer AAC system that looks at building language a little bit differently than the others. And so who would benefit from AAC? That takes us back to, what is the goal of AAC? The primary goal of the field of AAC is to support the communication and participation of individuals with complex communication needs. So these are individuals that can be more difficult to work with, or to determine what works, more difficult in terms of their behavior, more difficult because they may have multiple diagnoses as well. So they're complex communication needs. And when we look at this cohort of people that we're talking about, individuals with autism, approximately 25 to 50% of individuals with autism remain minimally verbal throughout their lives. So they have little or no functional speech. That number can change depending on early intervention. But overall, still today, that is the percentage that we work with. So when we look at autism, so if these are, so this is 100 typical people, or neurotypical, and the prevalence is 1 in 66 via the Canada Public Health Agency from 2019, although there's been a new statistic released that Autism Ontario hasn't quite adopted yet, but it's 1 in 50. So 1 in 50 people, or 2 in 100, which is what this shows, 2 in 100 people will have autism. And of those people, so if this was now 100 people with autism, 25 to 50% of them will never develop functional speech. So those people, those children, those adults, those individuals that don't develop functional speech are the people that are strong candidates for AAC. What if you don't use AAC? If you don't use AAC, or they don't develop a really robust communication system, and communication isn't functional, so it's not independent or clear, then that often leads to frustration and challenging behaviors. So there are many research articles to show that challenging behaviors or problem behaviors decrease without treatment once communication increases. So you're really, what our goal today and through the series is to really look at how do we choose a functional communication system which will be efficient, effective, and accurate. Those are the three sort of goals that we're looking at when we look at communication. So what does the research say? And I'm going to go through this next section, and it's a large section, but I really felt it was important that you understand the research, because the research doesn't match often what is being said on social media, what is being said by professionals. You really have to kind of be an expert in this area and consume this research and really tease it apart to find out what is going on with the research in AAC as applied to autism. There is a resources, in the resources section, there is a resource that goes through all this research too. And so you can, take it and go on your own. There's live links so you can access as much as possible. But I'm going to go through the highlights right now. So what does the research say? The research says that speech generating devices have large effects. However, very few studies actually included individuals with autism. And we know these individuals are different. So that is something that, even though everyone says, yeah, speech generating devices are evidence-based, there's a large effect, it may not match your individual or the person you're working with because they're not in many of those studies. When we look at AAC, except for picture exchange communication system, it isn't a manualized intervention, meaning there are not clear steps like a recipe of how do I do this, which makes research difficult because when we do research, we need it to look the same every time it's implemented so we can get some good data. So the not manualized is a problem, and that's where you want to really look at getting support. The other thing about research is the most common and greatest effect was only for requesting behavior, or as behavior analysts call manding. So if we're talking about answering questions, asking questions, having conversations, learning academics, we don't have research to show that that's effective yet using AAC. So we need additional studies to determine the effect on social skills, on academics, and on challenging behaviors to really see, is this something that's going to be very effective and useful going forward. There does appear to be a significant preference for speech generating devices over other types of AAC, such as picture exchange. We're not sure why, but there is a definite preference. And so we have to take that into account. If these are the individuals using the technology or the system, it's their right to self-determination. So as the adults involved or as the therapists and parents, we shouldn't be choosing all the time. We can do our best to match the system to the individual or match a couple systems to the individual. But if they show a clear preference for a system, that is their consent for that system. And we should be honoring that. And I've often seen that someone is using like a lower tech device, like a GoTalk or picture exchange, and the people in different environments want high tech because they like it, they use it, and it doesn't match what that individual's preferences are. So we really need to look at that as well. So what does the research also say about other things? So AAC alone may not help speech develop for individuals with limited speech imitation skills. So this goes this flies in the face of what's out there about AAC will help speech develop. Not all the time. For individuals with autism, there are some kind of prerequisite skills for that to happen. And it means imitation of speech is one of those prerequisites. So for those with limited speech imitation, you may need to add additional intervention components to target speech sound development to see those speech gains. So you may need to do an AAC program or implement AAC and do speech therapy as another program to build sounds and clarity and intelligibility and those things. The other thing we're seeing in the research is that behavioral methods such as differential reinforcement, reinforcement delay, speech imitation prompting may be required to maintain your previous speech or to increase speech during speech generation device use. So behavioral methods have been shown to be very valuable when implementing AAC. With increasing media coverage and social media about all of these technologies that are out there, there's pressure by parents to obtain the latest technology for their child. And the balance between client satisfaction and professional ethics becomes a bit more difficult. It's supposed to be that you go to the professional, they do an assessment, they do feature matching, and you'll learn about all those things, and they recommend systems and products and the way it's designed and the way it's organized. But what's happening right now is parents are coming saying, I bought this, and can you implement? And what parents have to understand is that speech pathologists, behavior analysts, AAC technologists or specialists must follow their professional standards and ethics, and they have to evaluate the effectiveness of the services and products and any technology and materials that are recommended. And they can only provide services when the products that are recommended or the products that are there are deemed to be beneficial, and it can be reasonably expected that they're going to be beneficial. So if there's a mismatch, then that professional really should be working with you and saying, look, I see you want to get there, but here's where we need to start. And those are difficult conversations. So what does the research really say? On the left is some current beliefs, things you'll hear out there. And on the right is what does the research actually tell us? So what people say is AAC won't hinder speech development. That's not exactly right. It doesn't guarantee that speech will develop either. Children don't need to match pictures or receptively identify pictures before using AAC. Yeah, they don't, but they need to have good visual skills. So there's some benefit to having good matching and comprehension skills when you're learning a new system. Remember, these are more difficult systems to use. So children don't have to start with low tech before using speech generating devices. That's a good question to ask yourself and discuss with the professional. So why would you not want to consider something that's meeting your individual child's or student's need and then building up? You're going to have more success in that way. And the last thing, the current belief is that there are no cognitive or behavioral prerequisites to speech generating device use. There are no prerequisites to picture exchange. There are definitely prerequisites to using speech generating devices, to using the technology that's out there today. There is no research that will say that you don't need prerequisite skills for using high-tech AAC. Yet that is something that is really out there kind of as an old wives' tale. So really it's not about iPads as speech generating devices. It's really about communication and looking at that combination of the hardware, the software, and the training. And all three have to come together with good support in order for that person to actually use that technology well. So how can you access these AAC services? So you need to think about some different things when you're going down this journey, when you're starting. You need to think about assessment. Assessment should come first. And you want assessments that look at current skills, speech development. You want to really get people that have that expertise in technology. So they're familiar with the hardware. They're familiar with the experiences with different apps, that they're not just going to pick their favorite or the one that they know, because that might not be best for the individual that you're working with or your child. You want to really understand that this is about teaching a first language. That individual was immersed in a first language of their home and did not acquire it. So they're still learning a first language. And none of us, not behavior analysts, not speech pathologists, not educators, have all the necessary teaching to really understand how to teach a first language. We still don't know how neurotypical children, babies and infants, acquire their first language. So that's what we're trying to do. We're trying to break it down, do the steps appropriately, teach, give help and prompting appropriately, and then fade all of that so the individual can actually acquire a first language that's varied, that's generative, that's spontaneous, that's independent, And we're doing all of that using AAC. So intensity is required, just like learning a first language. Parent training is definitely required. So you want to think about that. And then you really want to think about the level of expertise in that, you know, does my provider, are they an approved assistive devices program provider? And do they know AAC and autism? Because that is different than AAC and dementia, or AAC in acquired brain injury or traumatic brain injury or cerebral palsy. This is a specific cohort of individuals with a specific look of skills, and you really need to know that. So they've listed there where you can access some of the AAC services, support, and funding, and we will be expanding on this in the series. But what I'd like to do right now is open it up to some questions, and I'll get Allison to help me if there are some questions in here, and I can access them as well. And so I have had a number of questions, and that is great. I love that. So so Allison may have answered some of these. You'll get a copy of all the resources and slides. They're in your resource section of the platform, but they also will be provided on the Autism Ontario website so that you can access this in the future. What is the best way to communicate with a nonverbal child with autism? Really depends on what their skill set is. There's a lot of misinformation about children or individuals with autism have high visual skills, so they use pictures. That's alive still. They need to actually be able to understand pictures and what pictures represent. And so, you know, that's something where you would have to know the would you say to base decision based on, for instance, touch chat, LAMP, touch chat, some weren't listed, would you avoid them? It depends on your providers. It depends on the individual. There's a lot of ifs. What I would say is, if you base your decisions on evidence, on things that have been researched already, there's a better likelihood that that individual will make progress. System is currently the only AAC system that has been classified as having enough empirical research to say that you should be using it. Speech generating devices, again, it's an emerging area. So Proloquo to Go absolutely has the most research, shows the most outcome. Some of these other newer ones, Touch Chat has a bit, Go Talk has a bit. All the other ones either don't have research, or they have research that says, you know, it's not quite right yet. Some people benefit, a lot don't, or, you know, you're really trying to match for your individual child. So I wish I could actually just say use this, but there's a lot of ifs, and you have to go through assessments first and really make some better decisions. Here's another question. For young kids who do communicate but not in grammatically correct sentences or very long sentences, are there any AAC resources? I would say if they're vocal communicators, it's functional, it's accurate, it's efficient. They either AAC them would be temporary, but not typically would those people go to AAC. I would look at either getting speech therapy or ABA, or education, look at increasing grammar. So there's a lot of questions, and really we'll get into some of this as we look at the series. And what we're going to look at is, you know, where are the kind of points that we really need to think about? Is this just a theory, or is there solid evidence for some of this? Again, like I said, there's a lot of theories out there that have no evidence. So LAMP, I'll throw out some right away so you can think about that before the next session. LAMP, it's a theory of motor planning that has not been proven. And it's still, you know, there's research being done to show, does it actually work? And that's the jury's out on that one. Gestalt language processing or natural language acquisition, totally no research. This is a theory started by Barry Prezant and Marc Blanc, and there is no research to support it. It doesn't mean that we can't think about these individuals a bit differently, but you need to make decisions based on some other things and not get kind of caught up in this, you know, world of social media and people are going to workshops, and really ask those hard questions. Thank you. So before you leave, it would be really great if you completed this feedback survey. And also, there are a number, like I said, if you could finish the feedback survey, ask your questions in there, give us your response, and thank you so much for coming today. And I hope this is a good start for the series, and that we'll have a lot to learn over the series. Thank you, everyone, and hope you have a great day.